Good afternoon and welcome to everybody. For those of you that I haven't met yet, hi, my name is Hillary Godwin, and I'm the Dean of the UW School of Public Health. I want to thank you all for joining us for our second conversation in our series of health equity lectures. And today we have a great panel of public health thought leaders gathered together to discuss racism and health equity and our responsibility as public health professionals and in institutions of higher learning. And lots to talk about with this topic, very timely. Well, in the news lately, and I was just saying to Bonnie, I was just watching her do this incredible webinar, which I'll put the link in the chat box. Incredible webinar and panel that she participated in with the COVID Prevention Network on Train the Trainer about centering on communities. It was really fantastic. I highly recommend it. Lots in the news lately about how do we strive for equity in terms of vaccine distribution. So I'm sure people will talk about that today. Also, lots of conversations about how do we live up to our values within institutions of higher education. And I know for us within the school, lots of you guys have been participating in the anti-racism workshops that have been rolled out by our great EDI folks. And if you haven't, please do sign up for them. They really are fantastic. But it also, I think, is prompting lots of conversations about, what do we need to do in terms of really looking at our own policies and practices and how those are contributing to structural racism within our own organization. So I expect to hear about that as well. And very interested in hearing the perspectives from our panelists today. So before we continue, I would like to acknowledge that although we are joining this webinar virtually, that we are doing so from Indigenous lands. I personally am calling in from the land of the Suquamish people, and in Seattle, where many folks are calling in from. People are on the land of the Coast Salish people more generally, the Suquamish, Tulalip, Duwamish, and Muckleshoot nations. And we say these words to honor the people who are still here and on whose lands we are guests. And as always, we encourage you to learn more about the Indigenous lands that you inhabit. And we'll probably put in the chat box a link to some sites where you can find more information if you are interested. A bit of housekeeping before I turn it over to our panelists. As you can see from the screen, if you have questions for the panel, please type them into the Q&A box as opposed to the chat box. So we use the chat box for exactly what people are doing, which is just say hi to people, and also to share resources and links. Thank you, Monet, for adding a great website. But we don't use it for asking questions. We use the Q&A for asking questions. It just helps us in terms of organizing things a little bit more. Likewise, we do not use the raised hand function. So we're super excited. We have over 200 people online today, but it just makes it really challenging for the panelists to be able to follow who's raising their hands. We'll go in order of questions as they're posed in the Q&A box and probably try to bunch them up as well. And then finally, I wanted to mention that we are recording this event, and we will be making it available on our website and our YouTube channel for future viewing. The event is live captioned, and you can select captioning in the bar across the bottom of your screen where there's a little icon that says live transcript. So with that, I'm going to turn it over to our fabulous panelists who are going to self-introduce themselves. But I want to thank and pass it off to our moderator, Keshet Ronan. Keshet, take it away.
Thanks, Hillary. Hi, everyone. It's such an honor to share the Zoom stage with this panel today. So thanks for creating this opportunity. So as Hillary said, we'll just start with some brief introductions. I can start us off and share my name, positionality, role at UW, and the lens that I'm bringing to this conversation about racism and health equity. So my name is Keshet Ronan. I use she or they pronouns. I identify as white, and I'm an acting assistant professor and interim director of diversity, equity, and inclusion in the Department of Global Health here at the School of Public Health and School of Medicine. And I will hand it over to Clarence to introduce yourself.
Hello, my name is Clarence Speigner. I'm a professor of public health and a program director for the Study Abroad program and for the MPH program that we have here at the University of Washington in the School of Public Health. As far as pronouns go, you see what you see is what you get. So as long as you're not offensive, call me anything you want. And I'll turn it over to Bonnie, my buddy from we were graduate students together, and I have to say that we can't tell you about all the things we did when we were graduate students, but here we are now.
And I can tell you that Clarence's pronouns are he, him, badass.
Thank you.
But anyway, so my name is Bonnie Duran. I am an Opelousas Coushatta indigenous descendant, mixed race person. I am a professor in the schools of social work and public health at the University of Washington. And yes, Clarence and I did go to grad school together at UC Berkeley.
And Kush.
Hello, everyone. My name is Kush Doshi. I use he, him pronouns. Currently a student both in the health administration program and the School of Public Health, and then through the public administration program through the Evans School. And yeah.
I forgot I'm she, her pronouns. I'm sorry, I forgot. She, her pronouns.
Thanks all. So I want to just start by providing a little bit of framing for our conversation, and Hillary sort of started to do this. But in preparation for today's event, the four of us met a couple of weeks ago, and we shared our thoughts about the topic of racism and health equity and some of the things that the panelists wanted to discuss today. And in reflecting about that conversation, I think we really identified kind of three themes. The first is racism as it presents in the practice of public health and healthcare. The second is racism and colonialism in public health theory and education. And the third is racism in operational practices and the climate of public health institutions. And so in our conversation today, we're gonna try and explore kind of each of these different themes. And I will start with an opening question just to get the conversation flowing. And start with a focus on racism in public health and healthcare practice. So at the last health equity lecture in this series that Hillary mentioned, the panelists discussed how the COVID pandemic continues to highlight the ways that racism drives health inequities in exposure to risk, to infection, in access to testing, in access to treatment, and in access to vaccination. And so I would like to ask the panelists, what are the messages about racism that you hope people, both within and outside of academia, take away from the COVID pandemic? And Bonnie, let's start with you, since I know that you've been working a lot in this space in the last few months.
Wow, that's a pretty big question. And I think it's related to the COVID pandemic, but it's a lot bigger too. And that, I am an old mixed race indigenous woman, and I'm also, have a spiritual practice that lets me see my racism, sexism, homophobia, ageism, all of those structural, determinants of my bad behavior all the time. So I think, my first message is we all need to take responsibility for that. And we all need to do our, trainings on unconscious bias, and just know that we were raised in this wonderful, country and environment. And of course we have those things, we all do. And I think we all need to take responsibility for that. And around COVID, I've been so happy with how Indian country is responding to COVID. You know, I think they're responding really well, and we have a lot, not that much vaccine hesitancy going on in Indian country because we all want to protect our elders and save our culture. And so, you know, I think those are the biggest things right now that, you know, of course, there are structural elements. I guess one last thing is, I think, you know, we have to be really careful about who we hire in leadership positions, because sometimes we hire people in leadership positions that really don't understand their normative viewpoint and how racist and sexist it is. And that can be incredibly harmful to people. So I think that that's something, and, you know, Hillary, thank gosh we have her. You know, I think she's definitely bringing a fresh air to the school, and I'm very happy to, you know, have her there and to feel a lot more camaraderie and yeah, connection.
Thanks, Bonnie. Clarence, would you like to answer that question?
Yes, and I'd like to reiterate what Bonnie said about our dean. I want to be real careful. One of the things that I am very, very worried about, even now, is that I'm going to do or say something that that might embarrass her. And I'm not being patronizing, anything like that, but this has been one of the best deans that we've ever had in this School of Public Health since I have been here for the past 25 years. And if anybody on the line wants to go back and trace, okay, who we had since Clarence has been there, then you can go ahead and say that I believe that Hillary is above and beyond all of them. Okay, so having said that, the problem that I have here, and I hope again, yeah, well, what the hell? The pre-COVID, we had inequalities in health. Post-COVID, we're going to have those same inequalities in health. We're going to have the same racism that happened before the pandemic. I find it very fascinating and interesting and downright disturbing that the talking points that we're getting from a lot of folks that are, you know, they point the cameras at now about the vaccination rates and how people of color are less likely to be vaccinated and why. And everybody brings up Tuskegee. They don't go as far back as Bonnie with colonialism, that it started there as well, not just in 1930 to 1972, 1932 to 1972. So these are I mean, I know I'm sounding cynical as hell, but I think I got a right to. There is this concern that we have within institutions and in society that the same problems that people of color, issues of racism, were there before COVID, will be there afterwards.
Thank you. Kush, do you want to comment on this first question?
Yeah, actually, my answer also kind of perfectly ties into what Clarence just spoke about. So the first thing I would say is that we have to understand that racism is not a point in time concept. So when we're talking about things like George Floyd and what happened to, you know, Dr. Susan Moore, these systems of oppression and power and privilege have been here for years. And the thing is, they manifest in very different ways today. Doesn't mean that they don't exist, that systems of racism don't exist, they just look different. So when we talk, for example, about, you know, redlining, where Black families and Black populations were excluded from certain neighborhoods and accessing home loans, you know, we're like, oh, great, the federal law now prohibits it in 1968. But then today, and real estate agencies still use those same practices on choosing who they want in which neighborhoods and selling which houses, and Black populations still have trouble accessing home loans and things like that. And of course, when we talk about wealth gaps, you know, that's what the wealth gap is based on. A lot of it is based on property. So when we talk about, you know, intergenerational wealth, you can see that playing in there significantly. The other thing I want to say, because I think this is just something that's been on my mind, is how we think about racism needs to really change. And the way I mean this is, as public health and healthcare, sometimes for racism, which I would call a deep wound, right, in the US, we use what we call Band-Aid solutions. if we figure if we call a diversity consultant to come in and they give a few trainings to us, that will resolve all the problems in the workplace. But the truth is, you can't use bandages on deep wound problems. So one thing I really hope we step away from this really thinking about is how we address racism, because these things really take, if they've manifested for so long, you can't solve them in a year, 5 years, or 10 years. So we really need to kind of rethink and reframe on how we think about racism as more longitudinal rather than just a single point in time.
Thanks, Kush. I think that's a great segue into talking about examples that you have seen as successful approaches to heal those deep wounds in the context of public health practice, either in the COVID pandemic, before the COVID pandemic. As you've talked about, these are the same problems that have always been here. Kush, since you kind of made that framing, I wonder if you want to kick us off with this question.
Sure, I can. So I'll actually take it in a really unique context. So I'm in the health administration program. And last year as students, with everything that was going on and really realizing that we wanted to change a lot of the things in our program in regards to talking about these things, we realize we're educating health administrators that health administrators that may go on to become CEOs, CFOs, and yet, they haven't been exposed to these topics that are so critical. And again, not just in this point in time, but previously. So us and students, we actually got together and we formed this curriculum advocacy team. And over the span of just 8 months, the progress that we've made, I mean, we're talking about we've completely reformed and changed syllabi. And the biggest thing is we're doing this in collaboration with professors. That's the biggest thing. Reforming syllabi, changing the way our program thinks about equity, also connecting to our larger programmatic goals of like, what does it mean to include diversity, equity, and inclusion in our curriculum? So that's where a space where I see that we're making a lot of progress. And this is, I know it's a little bit in the academic space, but I think it's a really great opportunity for even the School of Public Health to think about how are we delivering content to students? And I think this will also go a little bit to what Clarence and Bonnie will talk about, but also thinking about how we retain and recruit staff of color and professors of color, and how we recruit and retain students of color who are going to be the future leaders in healthcare and public health.
Thanks, Kush. Bonnie, do you want to comment on successful approaches you've seen to combating racism in public health practice?
I do, and I wanted to say a little bit more about the first question, and that is, I think one of the biggest problems structurally is that from the very beginning of Western science, Western culture has seen itself as the pinnacle of social evolution, and that everyone needs to look like Western culture for the world to be advanced. And I think, we all know that that's tied to commodification and advanced laissez-faire capitalism and just trying to create more markets for the crap that we think we need to be happy. But, and I also think, about racism, that our white relatives, and that's one way we speak in Indian country, that everyone is our relative. Our European American white relatives are getting played by that. That concept was originated in 1687, I think, in order to keep the people who actually have a lot in common apart in order for the people in power to stay in power. So, and I think that is still pretty much happening. And right now there's a big trend, a really excellent critical trend called knowledge democracy. And it's about how we need to bring in knowledge systems from the global South. And, BIPOC communities in the US are part of the global South because our knowledge systems haven't been very credible or thought to be important. And I know in Indian country, people tell me, I do CBPR, so they tell me stuff and they're saying, we are tired of just being victimized and labeled all of these negative things. And as the more we look like you, then we'll be, the white male scientists. If we look like you, then we'll be healthy. And people want strength-based cultural revitalization. Native people lived 10 years longer than the European aristocracy in 1491. So people really want to do strength-based, resiliency-based approaches, cultural revitalization, to have pride in our own selves and, you know, share our incredible cultural systems with others. You know, we were thought uncivilized because we had multiple genders, because we thought we were nature, things like that. And, you know, if we bring those things back, we can share them with all of our relatives.
Bonnie, I just want to follow up a little bit because I know that you're you have a lot of experience in working in the co-VPN and really thinking about structural racism in the context of COVID response. And I wonder if you could share what you feel are some kind of success stories in combating racism right now. I know that you've been involved in that work.
Well, I think that, you know, tribal communities and Native communities have done an excellent job of figuring out what messages need to go out to tribal communities. You know, I'm on a Novavax, you know, vaccine team right now working with, and I can say who they are because they've gone public, the Lummi and Nooksack tribes in Seymour, actually. And, you know, they have very strong ideas about, and they're very deeply rooted in culture and strength-based approaches about how they are going to, you know, get people who might think, you know, might distrust Western science or vaccines. So, and you know, well, actually, you know, what has happened is the co-VPN, Michelle Andrasik, Dr. Andrasik, who is incredible, she created, in the beginning of this, she created 4 expert panels, African-American Black expert panel of just like 12 scientists, a Native American Indigenous expert panel, a Latinx expert panel, and a elders expert panel. And we actually, you know, got the very first protocols for Pfizer and for Moderna, and we raised heck, you know, we wrote letters of the 50 of us, you know, there's total 50 of us, wrote letters to Tony Fauci and Francis Collins and said, hey, you know, this is incredibly inappropriate. You know, we need to have a very diverse set of subjects for these vaccines. And, you know, we pointed out other ways that were very inequitable. And we were shocked that they immediately responded to us and made those conditions of protocol approval. So, you know, we were really happy to have a big impact. I have the letter that we sent and the letter we got back. If anybody wants to see it, I'm happy to share. Yeah.
Thanks, Bonnie. Thanks for sharing that. Clarence?
Yeah, you know, it's fascinating. The kind of, you know, what Kush said, I've never had that kind of conversation coming from faculty. Now, maybe it's just me, you know, I found out that some people think I'm intimidating, which I find, you know, really fascinating. You know, 74-year-old guy, and I can hardly make it up the steps. And everywhere I go, I see nothing but white people. So who should be intimidated? At any rate, the points that Kush has mentioned, you know, coming from students, I'm not being hierarchical here, Kush, but I just think it's fascinating that why can't we have those kinds of conversations with faculty? And again, maybe it's just me. In our Department of Health Services, we have over 200 we have over 50 regular faculty. They are called regular for some reason or other. And I've only had this come close to this kind of conversation with 1 or maybe 2 of them. And in our affiliate and clinical faculty, over 200. And I haven't had any kind of conversation with these folks at all about any of this stuff. My point is, before you think that this is personal, and it may be, you know, it could be that just, you know, they don't like me. I mean, you know, that's understandable. But when it comes to students at the graduate level and at the undergraduate level, that's where I see progress. That's where I see honesty. That's where I see the kind of conversations that Kush and Bonnie are talking about. People are actually, they're talking about it. They are not afraid. They are uncomfortable. They talk about their white privilege. They actually just say it. We've had college Republicans who, have to deal with an issue of Black Lives Matter. And, and this is where it's at. But I'm not finding it, and I hope this is just me. I'm not finding it among colleagues or people I'm supposed to call colleagues. And now it could be with the on-the-ground work that Bonnie is doing, that folks are getting together and they're mixing it up. And I think that's good. I mean, I really do appreciate that. But as I warned the folks who put this panel together, do you really want me? Because, I'm not going to say a whole bunch of negative things, but I am going to say the honest things as a faculty person and an African American with over 30, 40 years in academia. The other thing, one other point about racially mixed, I want to bring this up, and I'm glad Bonnie did, because, when I was in the military, and as I said, I was in Vietnam, and that's the last place you want to be on a college campus, is to be a Vietnam vet. But anyway, that's me. When I was in Oklahoma, I saw a whole lot of Black folks who were racially mixed with Native Americans. I mean, they'd been getting together for years, y'all, and that's what happens. But I don't see them now. Where the hell are they? When I look at the faculty and the people who are racially mixed and they're faculty folk, they tend to be a lot of white folks, white and racially mixed. Where are all those Black people, And I would like to even hear something in terms of research that's going on when we talk about indigenous populations, the folks who are mixed with Black. And I'm sure it's happening. I'm sure people are doing it, and I just missed the journal. But that's something we have to keep in mind as well, and that is something that I always go after when we talk about indigenous folks. We took over their lands, but some of us didn't. We didn't have much choice. We got brought here as well. So and we go back, to the 1600s, and we come forward with this. So these are all of these issues that have to be addressed. It's very complex, but it's nuanced as well. And I'm sure Bonnie got something to say to me about about what I said, and she would be right because I've known her for 40 years now. But this is something else that we have to deal with in terms of the honesty that we get from students. I want to sum up the honesty that we get from students, and they seem to be forging right ahead. We're on issues of racism, and the kind of shyness that I think comes from faculty who, for whatever reason, don't want to talk about it, or they feel that, oh, well, I find Clarence too intimidating, but what the hell are you doing in terms of issues of racism and health anyway, if you can't deal with me?
My cousin, Dr. Andrew Jolivet, does a lot of work on Black Indians. So I'm going to send you a link to his stuff. Yeah.
Okay, cool. Thanks.
Thank you, Clarence. That was a really great call to action and accountability for faculty, and I really appreciate that. I think that leads well into some discussion around our roles as an educational institution and some of our institutional practices. So maybe why don't we start with the institutional practices, since I think this has already come up a couple of times around hiring and diversity within the university. Why don't we start with you, Clarence? In our in our planning conversation and a little bit earlier today, you shared about the role of Dr. Blum and the role he played for you as a mentor. And I wonder if you could talk a little bit about the impact of that relationship and mentorship in general as a practice for improving institutional climate.
Yeah, I got to say, Kesha, it's and I'm trying not to elevate this man to the point where he's godlike, because I know how that would sound. But I've never met anybody else like him. And I think I was a year ahead of Bonnie, so I don't know how well she knew Dr. Blum. But he was just, a physician. a Jewish professor, and I have to say that because I used to raise a whole lot of hell about the Palestinians, and he would just kind of remind me, well, Clarence, you do know I'm Jewish, don't you? And I said, yes, sir. And he said, okay, fine, go ahead. Another point I need to point out about Dr. Blum that was so unusual when we were at the School of Public Health back in the 70s there at UC Berkeley. We had no Black faculty. I don't think we had any Native American faculty as well. We had one or two Latinos. I think David Hayes Batista left and went to UCLA, and he's down there now. So in terms of role models, we had no one, you know, and we as students, Bonnie and I, we were raising hell up and down the halls and on campus, everything else, saying, this ain't right. And Dr. Blum was the only one who would actually say, when we would ask, how come we don't have role models, Black professors, Native American professors, people, role models who look like us? He was the only one who would say that because the institution has failed miserably. I remember he used that term. You know, we could have done a much better job, but we didn't. You know, we have failed and we're going to have to do better. Everybody else was telling me that, well, you know, Black folks just ain't got what it takes, or the one that we had left. And, you know, they want to be around their own kind. So since there's not a whole lot of Black professors here, they don't want to come here. Everybody had a damn excuse, you know, except Dr. Blum to say that it is the institution, it is the system that has failed. And we have got to fix the system, and we have got to fix the institution. He didn't blame the victim, okay? He looked at himself and he looked at the institution. And so that's what, so in terms of role models, he passed away, he lived until he was 90, he passed away in 2006. I always like to say that he is responsible for me being here, but I'm sure there are others out there saying he's the blame. So, and I've always tried to be like him. I mean, you probably wouldn't see that now, but by and large, the way he interacts with people, his being a role model for students, addressing controversial issues and not being afraid to speak truth to power. And as I said, he's a quiet man. He reminded me a lot of, I'm going to date myself here, but he reminded me a lot of an aging Laurence Olivier. So if you ever saw any pictures of Laurence Olivier, the actor, and you see how when he grew older and everything. So this was Dr. Blum, tall man, quiet, in a sense intimidating. But again, until you got to know him. So I have tried to always be a role model. He has been my role model. And I have to be careful with that because in this institution, in our public health institution, one can say that, well, we can always get white people to be role models for the students of color. And that's not the point. That is not what it's all about. I happen to be very fortunate. I have to be very lucky. He was the one who sent me to the UK for a year to work for the National Health Service. And when I stop and think about it, I think he was getting me out of the line of fire because I was getting into a lot of trouble at Berkeley. So he says, no, you go, you know. And I went and came back, and now I have a study abroad program there. It enhanced my own dissertation, spending that year in the UK. I've got friends in the UK now. I look at the healthcare and class in the UK and everything. And it's just, I owe everything to him. So I've been lucky, and it shouldn't be luck. You know, it just shouldn't be just based on that.
Thanks, Clarence. I want to say that as you were talking, I saw a message pop up in the chat that someone said that you are their Dr. Blum, which I think is very sweet. Yeah.
Thank you. Thank you for that. Thank you.
Bonnie, do you want to comment on on your experiences of mentorship and how you see that as an important tool for addressing some of these institutional issues?
My experience with mentorship?
Yeah. Do you see that as an important strategy that can be used, or do you want to highlight some of its limitations?
No, I mean, I definitely have a very similar experience with Clarence. One of my professors, Mary Minkler, you know, I was about to graduate and she said, hey, you need to stay and get a doctorate. And I said, what? You know, I was a first-gen college student, you know, I don't come from a fancy education background. So that had a huge impact on my life, and she still has a huge impact on my life. You know, she's also a role model for me. And yes, I try to be, a good mentor to people. I actually have, I'm an intellectual hoarder, and I actually like to do annotated bibliographies. If you meet with me for a half an hour, probably 20 minutes later, I'm going to send you a 50-page annotated bib on the topic. So, that's one way that I like to work with students. And I particularly like to work with students of color, of course, and Native students. And I also believe in multi-directional learning. So there's things, that are in the student's history that I could learn. I don't think that I am the know-all and be-all. I'm trying to get away from that normative higher education experience. And yeah, I think mentoring is huge. I have a few people I'm trying to convince to come back and get either a master's degree or a doctorate, people who could really, the work that they're doing now is at that level, so they might as well get the initials to go with it. Yeah.
Thanks. Kush, is there anything you want to add to that as a student?
Nope, I don't have any comment. I think Clarence and Bonnie talked about it really well.
Okay, great. Since you brought up your identity as an intellectual hoarder, Bonnie, that is how I was planning to start one of my questions for you. You recommend a lot of resources about racism and public health and how to decolonize our pedagogy and our theory. I wonder if you could talk a little bit about what that means and what are some of the resources that you would really recommend for people within academic institutions as we think about education and pedagogy.
Well, I think we need to know the history of Western science, and I'm not, and this is one of the key points that I actually made in that broadcast that Hillary liked, that, we don't want to blame Western science. We want to make sure that we're making the distinction that it wasn't Western science, it was Western scientists. It was people who had a normative framework where, because of their gender and ethnicity, they were the commanders of everything. I mean, that was how settler colonialism worked, right? Settler colonialism made African descent people chattel, and it made indigenous people disappear and not existing anymore. And it's something that, we're both dealing with right now. And I think that, Western knowledge has some wonderful aspects to it, but it's not the only way of knowing. And, I think we all know that Western science and higher education has also been infiltrated by advanced laissez-faire capitalism. And, it's all about commodifying all of these cultural relationships, these family relationships, and these this culture, rather than it being something that's freely given and offered and just part of our life. Capitalism has to continue to commodify things in order for it to even sustain itself. And I think we're seeing the impact of that. And we're seeing the impact of that in education. Intellectuals used to be an excellent sounding board or voice for the most disadvantaged and oppressed people. Not that they always got it right, of course, but it was at least, one of their missions in life. And, I don't see, many people doing that anymore. So I think that that's really a problem. And I do think that we have to bring in knowledge democracy and acknowledge all of these other knowledge systems and ways of understanding and knowing, because Western science and Western knowledge isn't going to be able to solve all the problems that are out there right now. It's just not.
Thank you. Kush, I want to go back to what you said earlier around the actions that you and students have taken in your program to think about racism and colonialism in your curriculum. I wonder if you could talk just a little bit more about the types of changes that you've made and advice you have for others who are engaging in similar efforts in the School of Public Health.
Yeah, that's a great question. So the way I'll phrase this, and the way I think we as MHA students really look at it, is that we have privilege. So there's educational privilege and there's workplace privilege. So in the educational space, right, we all have to acknowledge that we have certain privileges that allow us to be here more than other communities. And often the same communities that are left out of education spaces are those that also we are making decisions for at a healthcare level, right? When we go into public health and healthcare institutions, we're put into this idea of having to make decisions for communities, but often we don't think about who's really at that table making those decisions, which is really the key part, I think, to it. Because to me, if we think about education privilege leading to workplace privilege, in my mind, we have to tackle on both sides, right? There's a work privilege of, how do we elevate communities of color? And if we're going to ask them to raise and elevate and be at the table, we should reimburse them. So that's the most important thing, like in terms of in whatever way that may look like. And the other part is, on the educational front, if we want, those communities to also be able to be in those workspaces and really lead their community and from where they came from, then the best way to do that is to think about what systems are preventing communities of color from accessing education, because there's a lot there. We could talk about funding. We could talk about the way we distribute who is accepted and GPAs and academic, like high school access. Like all of those factors affect, who is permitted, right, into an education system. So really, I just see this as tackling on both fronts, right? For education as MHA students, we said, we are unwilling to put health administrators out in the field to make decisions about communities of color when they have not themselves engaged in that work, right? A lot of this, when we talk about racism, it has so much to do about your individual story, and also how that story shapes your perspective about how you influence and operate in a daily. And so we just came to a point where we said, we're not going to allow this anymore. We want health administration to get education and build systems so that they continue to do their own education. And to really think about, again, at the end of the day, it's really about elevating the communities that you are making decisions for, just being really conscious of your privilege and what that power dynamic looks like. I think those are the key components. For advice for School of Public Health, I would say, it's not like this is not doable. Like I think the workplace is a really great opportunity where all the time we say, oh, if we bring in communities, that will be too many people in the kitchen, and we won't get anywhere and things like that. But I think often we forget about the resilience and the amount of ideas that could come from the communities that are living the place where you want to impact. I think often, like when we talk about communities of color, we say like, oh, we need to help them because this, and this, which is partially, yes, true. There's systems that do that. But then often there's also this piece around resilience and the ideas that come from those very same communities that could really drive a lot of the change that we need to make in public health and healthcare administration systems. So definitely don't leave those voices out.
Yeah, I'd like to back up a little bit, if not back up, but certainly support what Kush said, and to emphasize, recommend that it comes from the bottom up. I mean, I'm glad to see that really rattle the cages of the faculty and the people with the power, and that includes me. If you think that I'm sitting here saying, yeah, give them a hard time, it's give me a hard time. I often have to wrestle with the idea, how much am I a part of the problem and a part of the solution? Now, Dean knows I'm one of these folks who say, look, let's don't lower the standards in order to let people in, because all that is patronizing and it's racism. At the same time, should we modify the standards and such? And that's a question. Maybe it's just coming from an old faculty from old school and everything, but to the point where students can really make changes happen and put that pressure on the status quo, including the faculty, the deans, the admission committees. All of these things come into play, because that's where I see the change coming. and the conservatism is what I see at the top, among the status quo. I mean, that's why the term is used that way. So I am very, very, if anything, no, not trying to be patronizing or anything, but I'm so glad when I see change coming from the students. Those are demanding change. Make life miserable for the faculty if you have to. I mean, really, seriously, because that's the only way things are going to change. And I think that's always been the case. That's what Black Lives Matter is about. I mean, who would even be looking at this if Black Lives Matter, if we didn't come to this racial reckoning when families, white families, a lot of white people were forced to be locked down and forced to witness the murder of a man, and then, said, okay, we got to do something about this. So it's coming from the streets, it's coming from people, and in academia, it's coming from students. And it shouldn't have to be. Students come in to get their education so they can go out and make a difference in the world. But to the degree that they see where, hey, there's something wrong here in this institution, then make the changes. We are University of Washington. We are part of we're number 7 if you believe in those US News and World Reports stuff, which I don't, but anyway, we use it to recruit students. And the 10 top schools of public health, Johns Hopkins is number 1. We've been hearing a whole lot about them. All I can think about with Johns Hopkins is Henrietta Lacks. I keep thinking about how they exploited the hell out of her, and University of Washington has got its problems as well. And I have no problem in pointing those problems out so that we can face them, so that we can deal with them, and not say that, oh, don't say that because, we want to be positive. Well, we want to be honest. And I think people will appreciate the fact that we are honest about our shortcomings and what we have to fix in order to address issues of institutionalized racism and structural racism and such.
Yeah. And can I add something to that? Kush and Clarence, brilliant. And, the University of Washington isn't one thing. I mean, we talk about it like it is all the same, in a way, and I'm going to be real honest. I left the School of Public Health because I, was experiencing a lot of microaggressions. It was the most painful work experience I've ever had in my life. But I went to the School of Social Work where the Indigenous Wellness Research Institute is, a wonderful gathering place for Indigenous and Native researchers. And, the School of Social Work, 60% of our undergraduate students are BIPOC and 47% of our graduate students are BIPOC. So, it shows that our dean too, Dean Eddie Uhura is an fabulous dean, and she's always picking out, particularly women of color and putting them into leadership positions. I'm the faculty council chair of the School of Social Work right now. And, that has a fair amount of power with it. And she makes sure that, people who have the ability, which is everyone who makes it there as a job, she makes sure that they have opportunities to learn and to exercise power. So that's also another thing, that there's probably other places in University of Washington that are doing that well. Maybe we should, look around and see where that's happening well, and, take some of the practices and principles of those units and try to spread them around at UW. Yeah.
Yeah, I have to confess that I quit talking to Bonnie for about a year because she left me in the School of Public Health. But thank God we have Hillary Godwin there now, so I'm okay.
Yeah, Bonnie, as you were speaking, I was thinking just that. I was thinking about, you outlined some things that you identify as strengths in the School of Social Work. And what are the lessons that we can learn about that as we move towards being an anti-racist institution?
Well, I think it goes back to making sure you know who the people in power are, and I think Hillary was an excellent, and, Dean Eddie is an excellent dean. And I think that that's one of the things to consider. People understand, because a lot of people don't even understand their normative viewpoint, right? I mean, I work with a lot of brilliant white male professors and scientists who I actually think have excellent ethics. And sometimes they'll say things like they don't even realize that their viewpoint is absolutely gendered and cultured, and they universe, a lot of us, and I do it too, I have to watch that I don't do it. We universalize our subjectivity and think that we know what everybody should be thinking and what they should be doing, when that's totally a manifestation of settler colonialism, in my view. When we Kush spoke brilliantly about getting communities involved, and it's also for their voice, but communities have the best theories of etiology of why there's health disparities than anybody else. They know from direct experience. So we need to give them voices, but here I go again with my intellectual hoarding. There's this wonderful feminist philosopher, Miranda Fricker, who talks about hermeneutical resources and epistemic injustice. And, I think we need to give space for communities to do their own meaning making about why things are happening. Her big example is sexual harassment. How long has sexual harassment been happening? Since the dawn of humanity. That term was invented 25 years ago. How many terms are out there that we need communities to do their own meaning making to really understand on a totally deeper level what's happening and how to fix the problems?
Thank you, Bonnie. I'm going to move over to audience Q&A in just a few minutes, so please submit your questions, but I'll just ask one more question before we move to that. I think, Kush, you talked about access to education and students. Clarence, you talked about, and Bonnie, you both talked about representation in leadership and among faculty. I'm curious to hear your thoughts about how we can move towards having faculty that are more representative, where we really have a critical mass of BIPOC educators, thinkers, role models here at the UW in the School of Public Health.
Who you asking?
Why don't you start,
any one
Clarence?
of us?
Any one of you. Clarence, why don't you start us off?
Yeah, well, okay. I mean, how can we change the system? It's certainly pressure from students can help. I know alumni associations, I know they're probably on this call. I would hope that they too will pressure the university, the school, that they want to see more representation. And not just in the alumni magazine, where they always go find some of us from somewhere and, and feature us and all of that. And it just comes across as PR. It comes across as meaningless. And as Bonnie pointed out, the community, Black and brown communities, BIPOC communities they know what's going on. I mean, they look at this and see us as just another bunch of smiling ivory tower academics who show up to get the data and disappear. Now, again, that's crude because community-based participatory research is trying to control for that. They already know that this is what communities think, and they're trying to make sure that that doesn't that's not always true. But by and large, for those of us, I mean, in order to get the big grants and the millions of dollars and all of that, and the way they got it set up now in the culture of the academia, you don't even need tenure. And for Black folks, I can tell you, and certainly BIPOC communities, but tenure doesn't mean a paycheck. It means that you can speak truth to power without being fired or retaliated against. And that is a cultural dynamic that I don't think, and I'm being generalist here, I don't think that a lot of white scholars get. in the old days they did, with Howard Zinn and some of the others who would, they would say things that were very controversial and write about stuff that was very controversial and get called in because, and sometimes fired. But that we have a tenure process here now, something called 50% tenure, none at all, where as long as you're bringing in the bodies and counting and calculating the p-value and publishing in journals nobody reads, then you got a job. And that has to change. God knows I understand. I mean, I pay my mortgage payments as well by getting the grants and publishing. And but it just can't continue like that. I mean, there's got to be some serious conversation within the status quo to say that this can no longer be business as usual. And I would hope that I live long enough to see something going on. Perhaps maybe because we're having this kind of conversation, that might be a first step, I would hope.
Thank you, Clarence. And I just want to, support what he said and say that one way is it's very hard for, one Native or one African American or one Latinx to work in a school or a department without support, because even though right now we're being highlighted, oh, look how great we have faculty of color, there's a book out there called Presumed Incompetent, that we get much lower student ratings from classes. And, I've had experiences of fellow faculty feeling like I was a affirmative action hire and that's all that I was there for. And, even when I was PIing multiple R01s that people probably didn't know about because they went through our research center in the School of Social Work, people often will not think very highly of us, and it's their inherent bias. That's why I think it starts with us really seeing clearly that we have been conditioned to see the world a certain way, and it's not the truthful way. It is, a way that's based on certain privileges and discounting other people and genders and ways of knowing. And, it supports people to have what they want and what they need and then some, and it supports other people for trying to be like them, or you're not going to succeed. And that, that's got to come to an end. The world is filled with incredible knowledge and incredible cultural systems and ways of being in the world, and those have to be honored at the higher education level as well.
Kush, is there anything you want to add to that?
No, I think Bonnie and Clarence talked about it really well. And I the only thing I would add is, the one thing that always bothers me is when I see professors on the website, for example, and they're like highlighted, like, oh, this is our faculty of color. And I come here and I'm like, whoa, they must have a diverse faculty. And then I see one. My biggest thing to programs is you cannot hire faculty of color without any of those systems that are meant to support and retain them over time, and then just have them as like, oh, this is like the token professor that we're going to put on every flyer to show that we have diversity, right? Like that doesn't work, right? You have to reform your curriculum. You have to reform a lot of those things that you have to make sure that we are including DEI in every facet of the school, right? Not, it's the student retention, it's the professor retention and recruiting, it's the curriculum itself. What are you teaching students about what it means to be in the field? I think all those things affect the way where professor of and faculty of color choose to go. This is a problem I've seen at UW, where a lot of the professors of faculty or that of color that come here, they don't end up actually coming here. They choose another option, and then we have to ask, why did they choose another school? It's because a lot of these reasons. So I think we need to really, again, shift that mentality around.
Yeah, I know we have to move on, but I just want to emphasize something that Kush said, because we talk about this dilemma, this contradiction this void that we're trapped in. I don't know where you guys found that awful picture of me, but they found it somewhere. But I normally don't feature my picture at all, precisely because of what Kush talked about. But at the same time, my colleagues tell me, well, Clarence, if you're not going to feature yourself, then how can we let people know that you're here and students will apply? So it's kind of like a dilemma that we're all in. So, I mean, I cannot condemn my colleagues who say that, oh, why did you let them take your picture and put it up there and everything, and I don't. I'm not right and they're not right. I'm not wrong and they're not wrong. It's just this choice that we have to make. And it's our white faculty, our white colleagues don't have to worry about that. They got their pictures up, with the cat and everything, and they're quite happy. But the rest of us, what message are we sending here? I mean, are we playing into the status quo? Are we supporting institutionalized racism, or are we condemning it by saying, no, you're not going to use me like that? And who's right and who's wrong? I don't know. It's just a dilemma, that we go through, that our white colleagues don't have to worry about.
Thanks, Clarence. That is really powerful. There's actually a couple, so I'm going to move over to the Q&A. And as we discussed, panelists, you can also see the Q&A. So if there's a question there that speaks to you, feel free. Since you were just talking about the toll and the experience of having a minoritized identity, wondering if you were tokenized, questioning what it means to have your photo on the website. There are a couple of questions in the Q&A about how people confront and deal with being on the receiving end of institutional racism. So there's one question: how do we make change and go against the grain if we're on the receiving end of discriminatory and racial harms from faculty for doing so? And another question that speaks to someone who called out institutional racism that they experienced both as a woman of color and as the only student of color in the inaugural public health genetics program class at the UW School of Public Health. This person is now starting a new job as faculty at a Midwest university, congratulations, and is wondering how to tackle these issues and experiences of institutional racism today. So both of those questions, I think, really speak to being on the receiving end of institutional racism and wanting, I guess, your thoughts and advice on that.
Well, there's one concept called emotional labor. Do you know this concept? And it's what, I think it's a sociological concept that relates to, people, non-BIPOC people or our white relatives asking us, well, what is it, why is that so hard? Or please explain your, status to me, or, explain to me why things are like this, or what's your experience of this? And how come, you can't rise above this or whatever, they're wanting us to explain to them what it's like to live in a society that, wants us to speak the status quo and support the prevailing ideas about this and that. And, one thing that I did once that actually put an end to some of the harassment for a while was I sent actually one of my supervisors a one-page, flyer on microaggressions. And I said, hey, I think this might be happening between us. And I know that, that's not your intention. So let's talk about this, next time we meet. So that was an interesting thing. But I think it's very difficult. And I think that a lot of us don't even realize how much we're just, doing the status quo work and, doing what is expected of us because we don't feel we have the freedom to really speak up. Clarence was absolutely right about tenure. But for me, I didn't even realize how quiet I had been until I became a full professor. And then it was like, oh my gosh, I could say anything I wanted. And my ideas about things, it was almost like a hermeneutic to do meaning making outside of the, main viewpoints of, epistemology. So I think that It's a struggle. It's a struggle for us too. But I think, you know, one thing, I'm on the board of Wide Awake. I want to recommend Wide Awake to everyone. I just did a Town Hall Seattle. I don't know if you guys saw the Town Hall Seattle on this book. This is a great book, boy. It's about how, you know, white people are getting played too. They're getting played by the system. You know, you're losing a lot of your own cultural identities by being white. What do you mean is that? So I think that it's liberation for all of us. It's not just by, you know, BIPOC people.
Yeah, I can say that you know, we talk about where we are and how we got here and survival and such. I'm using those terms. They may be sound negative, but I think they're quite appropriate. When I was at again, as I talked, when I was at UC Berkeley, I had Dr. Blum running interference for me because I got a big mouth. Now, I mean, I was always talking and and saying things and doing things. I did my work as well. So I mean, he recognized my scholarship, but at the same time, he recognized my anger and frustration as well. But I had him, and then when I became an assistant professor at the University of Oregon, and again, people, please don't take this wrong, but I recall when I went up for tenure, it was the female faculty who looked at my application, and they said, Clarence, you can't say this. And I said, you got to be kidding. It said in the book, in the brochure, that I should explain who I am and what I am and why I'm doing this. And they said, yeah, you can do that, but they already don't like you. So this is gonna make them hate you even worse. And they took my stuff and redlined it all over the place and threw stuff out and got, you know, and it was because of them. Again, this was the Center for the Study of Women in Society. I think it's still there at the University of Oregon. And that is how I got, you know, got my tenure because nobody makes it alone. People are always watching out for other people. I've been fortunate, you know, that you know, there've been some white folks out there that, but to the extent that they're not there, you know, you can really fall by the wayside. What other thing? And I know we have to get to some questions here, but Kush, I want to make his point there as well, because students even have to kind of, they have to kind of walk a tightrope. If you're too militant and if you're too forward and such, you still got to get those letters of recommendation from the faculty that you might be telling them that, hey, you guys aren't doing a very good job of this, or this is what has to happen. So you kind of walk a tightrope there. Some faculty appreciate it and said, yeah, I'm glad you did what you did. This makes us move forward. Some may feel that, you know, you really give us a hard time and I think you're a troublemaker. And my letter of recommendation for you, if I write one, is not going to have so many adjectives in it and such. In that last paragraph, call me, you know, and I'll really tell you about this guy. So, you know, for those students who, and I'm talking about students now, who really need to make it, I mean, they walk the tightrope as well. So it's an emotional trauma for them as well. And it's, you know, it's a very, very difficult thing to do. Last point, we have one student on the art search committee now. I won't say who she is, but she has really responded in ways that I never really thought about. The committee never even thought about, in saying that the same structures that we're talking about, we want this arts director to be able to address. We're using those structures to keep people out. We're saying that, oh, this person doesn't have enough grants, or this person doesn't have enough publications, or this person doesn't have, and we're saying, well, wait a minute, we're doing the same thing that we're saying that this directorship is supposed to. And it took a student. It took a student. It wasn't just me, you know, who came to that realization. It took a student to tell all the rest of the professors on there that, you know, you guys are, you know, and she was being real careful. She had to be said, okay, I want to make sure that I'm not being disrespectful. But it took that. And so, you know, thank goodness for the students.
Thank you. Indeed. There's a couple of questions along that line, speaking to how faculty can do better, essentially. So one question is asking, research shows that many white faculty overestimate their preparedness or ability to mentor BIPOC students. Well-meaning but bad and even traumatic white mentorship seems to be happening a lot at UW. what should faculty be doing to become better mentors for BIPOC students, and how can we support them? And then a related question, I think that's a little broader, what key performance indicators of faculty would be more conducive to health equity and moving towards anti-racism? Do any of you want to take that one? Clarence, you're off mute. Does that mean you want to speak?
Well, goodness, I should have put myself back on mute there. No, the question, the question being, how can faculty better prepare themselves to deal with BIPOC students?
Yes, to do a better job. Yeah.
Yeah. Oh, I'm sorry. Yeah. To do a better job. Yeah. I think, again, I'm always holding, my mentor up, and, there's just hardly faculty. I mean, we're all okay. You guys tell me if I'm wrong here, or if my description of us as faculty is a bit narrow. But a lot of us just don't have good social skills. I know the reason why. I know I could never hold down a 9-to-5 job, and I tend to be introverted. And I read books and I become the character in the book, or I become emotional sometimes, even when I'm reading letters of diversity letters that students write. When they write about what their family and what they went through, I start crying. And so we're all a little weird, I think. And the whole point about not having very good social skills, I think that if a white faculty person really wants to see some change, they've got to recognize their white privilege, and they've got to recognize, I really do believe this with their fellow faculty of color, if they've got any, or even with students, that when they do screw up, I mean, if they do say something, ghetto instead of barrio, or gypsy instead of Roma, that most of the time, unless something else is going on, I think that the student will correct the person, and they'll do it in a respectful way. I do recall when I was just finish up my doctorate, and I gave my presentation to a room full of undergraduate students. There must have been about 200 in there, and I kept saying Oriental this and Oriental that. And and then when it was all over, I'm very proud of myself in putting my notes away, and I looked up, and all the Asian students were still there looking at me, and I said, and they just said that, hey, we're not rugs, and we're not vases, we are Asian, and that taught me a lesson that I have never forgotten. They were polite about it. I screwed up. I should have known better. And they told me, I didn't read about it in the Daily Californian, or, heard about it on the news the next day that professor screws up. But they told me, I'm not saying every student should do that, but it certainly helps when you can learn from every situation. And I would think that white faculty need to open themselves up and not close their office door, or say that they don't want to get into trouble because if these students are microaggressions, no matter what we say, no matter what we do, we're going to offend them. This is what addressing racism is about. Incredibly uncomfortable. It's very uncomfortable, and you have to take that chance if you really want to be a part of change. And that's the only way we're going to be able to address racism in public health or in any other discipline.
Kush, I wonder if you want to comment as a student on how white faculty can do better as mentors to BIPOC students, or more generally, what performance indicators for faculty would be more conducive to working towards anti-racism.
Yeah, so the two things that immediately come to mind for me is one, in a mentor-mentee relationship, expectation, right? In a typical mentor-mentee, you learn from each other. So, one of the things that I would encourage, right, white faculty mentoring BIPOC students to really take the time to educate themselves. Because the worst thing that I've been in faculty with that are white, and they'll say, I understand where you're coming from. Well, you don't, right? That's part of the experience. I have mine and you have yours. But to say that you understand where I come from, where I've been, is you can't, right? It doesn't work out that way. The second thing I would say that came to mind was ask and don't assume. Because a lot of times there's white faculty and they will tell me as a student of color what I should do, who I should connect with, you know, where I should be going and headed. But the thing is like, I would rather you ask me those questions and then really recircle the mentorship around my goals and how I view and shape my world and perspective to be, rather than just assuming. And that goes for healthcare, because the biggest thing you ask any provider, a lot of providers are afraid to ask their patients, help explain to me, you know, how your traditional beliefs influence the way you see medicine, right? Instead, they assume and make prescriptions or provide a treatment that doesn't align with the patient's values. So I think that lesson, the ask, don't assume, goes even beyond mentorship into real workplaces when we are working with populations. So.
Thanks, Kush. Bonnie, is there anything you want to add to that? Covered it? Okay. Just checking the time. I'm going to move to a different question now. Someone asked, how should someone who is earlier in their career make meaningful career choices that will align with health equity? So this kind of takes us back away from institutional practices to really thinking about how we can all be agents of change as public health professionals. Anyone interested in taking that first?
I'll say a few words on that.
Oh, go for it, Bonnie.
I think that, you know, we want to make an impact, but I think that the system is having an impact on us. Actually, lately, I've really lived the term moral injury. You know, a lot of people say, oh, you know, I'm only an associate professor and I'm already burnt out, or, you know, people talk about burnout, and it's not really burnout, it's moral injury. And if you guys want to look it up, you can Google ZDogg MD and moral injury, an excellent little 6-minute video on what it is. And what it is, it's us trying to make, you know, substantive changes and to promote equity, you know, health equity and, you know, wellness for our populations, but we're doing it within a system that is kind of broken and won't allow us to do it. You know, and that can be very, you know, it can be very discouraging to us. For example, you know, I am one of the supposedly, you know, what's the term? I'm an OG of CBPR. And, you know, I'm wondering whether higher education can even do authentic engagement with, you know, the systems that are in place. So for me, I'm really questioning whether we need to have, you know, much different administrative structures and different systems in place for us to really do the social change work that we want to do. And maybe it's not in education, maybe it is in community organizing and political change. And, you know, sometimes when I say, oh, you don't need to be an organizer, you can come do research, I'm, you know, really questioning saying that anymore, because I don't know if it has the impact that we want it to have. Because the system is so, you know, as we know, we call medicine the medical industrial complex, right? And so I'm just really questioning at that point. And, you know, tribal colleges, I work with tribal colleges as partners, and they do have a pretty different system. So I've seen that different systems can be welcoming and helpful at the community level. So I think it's possible. Yeah.
Kush, it looked like you unmuted earlier. Do you want to add to that?
Yeah, the one thing I would add is, you know, when you were talking about aligning ourselves with equity or thinking about equity, I always say that the most important place to start is yourself, right? Understand your story, understand your perspective, and you also have to be okay with understanding that you're not going to have the answers all the time. That's okay. Even for myself, every day I say, you know what, I'm learning something new every day. You know, understanding racism and the systems and all that takes a long time, right? So I would start with getting in, just thinking about, you know, educating yourself, right? Starting from that place, and then again advocating for those things in the workplace. Now it's harder as a community, as a person of color, advocating in those spaces, because sometimes people view you as, oh, and I've gotten this as, oh, there's the, you know, the angry brown man over there who's all about to, you know, raise hell about, you know, racism and stuff like that. So it becomes tough as a person of color. Now, if you're a white person and you're doing all this, you have more privilege in the workplace to challenge the systems that you're a part of. That's the one thing I would encourage, you know, students and faculty and everyone. We're in the School of Public Health. Don't be okay with the way the system is now. Because if you graduate from this program and you go back to those systems and you perpetuate the systems, you become part of the problem, right? So just, again, really take a step back, start with your individual perspective and story, and then really understand all the systems that are in an interway, just playing with all of those things that you're dealing with, and really navigate those and be able to challenge them and raise your voice when it's needed.
I would really like to back up what Kush said and what Bonnie said, but the point that Kush made about you're just looked at as another angry black man. I'm still reeling on that. I found out this morning that, you know, a lot of my colleagues that I'm intimidating them. I mean, I laugh about it and then I'm insulted about it. I mean, my God, I'm one guy, one person, one old professor way past the age that he should have died a long time ago, given, you know, weathering and racism and all of that. And, you know, I'm one person. You know, I step outside my door and I see nothing but white people. I come to work, I see nothing but white people. I go, you know, I go jogging, there's nothing but white people everywhere. So who in the hell should be intimidated? I can't get over it. And I really need to talk to Bonnie, sit down and, you know, have a drink or something and, you know, try to figure this thing out. Because it just makes no sense to me that, as Kush said, it should be the white faculty that's out there, you know, rattling the cages and maybe, you know, talking truth to power like I'm doing, or doing it their own way. But to sit back and say that, oh, we don't want to do anything because Clarence is angry. Do you goddamn right Clarence is angry, and you ought to stop and think about why, you know. So anyway, I don't want to personalize this too much, but I think Kush's point was absolutely correct about white faculty need to use their privilege and change things and, you know, open up those doors like Dr. Blum did and let people in, you know, let them in. They can do the work. That's no issue, but it's the you know, those barriers that are keeping people out. Yeah.
But they need to decolonize those racist ideas and opinions first. I mean, they can't even see their normative frame most of the time. And you know, patriarchy is pretty big too. So
Yep. Right. Mm-hmm.
And the one thing I will add, because I've seen some of these questions around this, and I think it's a lot on people's minds, is everything that happened with Dr. Ben Danielson at Seattle Children's. There's this huge lesson in that, because here's the thing. People on the outside of Seattle Children's, I've seen and I've heard a lot of this where people are saying, oh man, that organization over there, they promote racist policies and the yada, yada, yada. Here's the thing though, those policies and racism and all of these institutional system is at every place, including where you work, where I work, right? So if we are not looking and examining at the place we work, and challenging those systems, then we're just, again, perpetuating the problem. And the other thing I wanted to point out is that I feel like in public health and healthcare in general, we have something called the procrastination problem when it comes to racial equity. And let me tell you why. When Dr. Ben, just think about this for a minute. If Dr. Ben Danielson hadn't left, those same policies may have been at that healthcare system for years. But because he left, now we are going to change our policies. So I want you to think about that for a minute, because this is what I call the procrastination problem. When some event happens, and God forbid it's in the media and it points at our organization that we are racist, now all of a sudden we want to be engaged in equity and we want to change things. So as future healthcare leaders and public health leaders, just be really conscious about that, because this is not a procrastination problem. Because if we're talking about racism that's been on for hundreds of years and we can't solve it in 1, 5, or 10, there's no reason why we should be waiting last minute to think about it, to be really thoughtful about how we're going to engage in this work. So I just wanted to make that point, because that's something that's really stuck with me as a lesson learned coming out of that.
Yeah, and I just want to back that up. That the Ben Danielson, for those people who know, there are some people online probably who don't know him. But hey, this guy was the Martin Luther King Jr. of the medical establishment in Seattle, and that's a compliment. Believe me, I mean, brilliant fellow. I mean, just in his own way, a kind of Dr. Blum. But no, young fellow, and I think I can say that at my age. But the Martin Luther King, that's how I describe him. He wasn't the Malcolm X, he was the Martin Luther King. If you couldn't get along with him, you really got a problem. And the fact that he, when he brought the charge of institutionalized racism to Children's Hospital, that should have been a lesson or a case study for everybody. We should be having courses on what in the hell happened there, and because the things that he articulated out, and everybody should be looking within, given what happened with that particular case. So yes,
Thank you all so much. You all are brilliant and amazing. It's been really wonderful to share the stage with you. I would like to ask one tiny final question before I hand it back to Hillary. And I want to end with an exercise in radical imagination. And I would just like to hear, 30 seconds from each of you of, and this is taken from the Q&A. What does success look like? What is the world where the UW is anti-racist, where public health is anti-racist? Just paint a picture for 30 seconds for us. Come on, radical imagination. It's our most powerful tool.
I
Kush.
think it means
Okay.
we all understand our deep interconnectedness and our relatedness, and that, when people are suffering, we're all suffering. And, happiness isn't accumulation. It is having intimacy and respect and knowing that you're doing good and knowing that you're not harming. I think it's us understanding where happiness is, and what things and opinions we have are actually causing suffering, and to us to look internally. I really believe that's the first step, is to do our own unconscious bias inventory to see how we're contributing to harm, and how we can move towards happiness and our interconnectedness.
Thank you.
for me, it's being able to listen. Just shut up and listen. That's one thing, and I'm not saying this because the dean is back, but that's one thing I've noticed about her. She listens. She doesn't agree with me. I mean, she sometimes tell me, yeah, well, you're wrong, but she's listening, and I know that I've been heard, and that makes more of a difference than anything that people in power, and I'm putting it that way, are listening, and they're not assuming anything, and that they want to learn, that that I have something to teach them, as much as they have to learn from me. So being able to listen, that's the that's the message that I'd like to leave with.
Thank you. And Kush, you're our next generation, so tell us, you close it out.
Yeah, of course. So in terms of anti-racist school public health, right? For me as a student, it would be seeing students like me in the classroom. It would be having faculty of color that could teach me just, about how all of these things, and having white professors engage in this conversation. Having an environment where we could have these conversations in the first place. And also, I want to get to a point where really the end point is where any time that we're talking about healthcare and public health, I would love for people in my class to instantly think about how equity ties to this, rather than a person of color. Usually what I've seen people of color having to bring it up in class, right? I think that ties a lot to what white allyship actually looks like. And so I think that would be the ideal state.
Thank you all. Hillary, I'll hand it back to you.
Thank you so much, guys. I am humbled and appreciative of your kind remarks, but I guess I would just like to acknowledge, Clarence, I'm sorry if I tell you that you're wrong, but sometimes we don't agree, but I learned so much from you, and I have learned so much from each of you guys today, and look forward to continuing the conversation. Want to thank you all for being here, to just saying it like it is, being honest and straightforward. Kesha, thank you so much for moderating. You did a fantastic job. I hope all of you will join us for our next health equity lecture, which is going to be on Thursday, March 4th from 4 to 5:30 p.m. And that will focus on a conversation about environmental justice. In the meantime, please expect a follow-up email that gives you links to the recording for this session. Until next time, I wish you peace, truth, and health. Good night. Thanks.